Hi, good afternoon. So today we're gonna talk about imaging, and is imaging perfect? Like, and what by that I mean, yeah, CT scans, PET CT scans, MRIs, ultrasound, X-rays. So the answer is that they're not perfect. And for example, like talking about, say, a PET CT scan where you're injecting radioactive sugar, for it to detect tumors, typically you need, like, the tumor's got to be of a certain size, like, say, closer towards 1 centimeter or 10 millimeters. So if something is 3 millimeters, maybe five, doesn't mean the PET scan is going to pick up that uptake. So if you, for example, sprinkled salt and pepper on a desk, and no PET scan, no CT scan, no MRI, no X-ray, ultrasound's gonna generally pick that up. So you have to understand that these imaging tools are they're tools. And this is why when sometimes cases become more complex or there's questions, they start running like all the different machines. So the CT scan, the MRI, and because sometimes a certain technology might be able to pick up something that's harder to pick up with another's. The other variable also is the radiologist. So I know there's artificial intelligence being discussed more, like here in British Columbia. To my knowledge, I don't think it's still being used. But radiologists, they get tired eyes, long days, and so sometimes it's difficult to read these things. So it's not only just the machines, it's also who's reading them. And there is variations. That's what we've noticed. And so just keep in mind that cancer can be intricate and complex at times, and that's why sometimes oncologists don't say much until, like, they get blood tests in order. Maybe they do some physical examinations, and then looking at imaging, and they put it all together to put things into creating a clinical picture. So they're not all perfect, all those technologies, but they're useful. Another little fun fact is, like, basic X-ray. If you're looking at, say, bone metastases, well, you generally need 30 to 50% or higher bone loss just to find them on X-ray, on basic X-ray. And so you can imagine someone goes through, get an X-ray, and it's like, oh, my bones are fine, right? And then you do a CT scan or other, and they're finding little lesions on the bone. So it's the limitations of the technology, and so that a lot of people don't know. And so it's not to say they're bad, but there are some very levels of limitation at times. So remember, the clinical picture is the key. And so sometimes they're not always perfect, but at the same time they're also quite useful and good if you know how to use them.